Good morning, everybody. It's Dr. Galvin with the post-ER coronavirus update. It's a long night. I'm a little bit beat, but I decided I'd just go ahead and film it here at the hospital. I'm in our little doctor's break room where we kind of have a shower. We kind of come here now to decontaminate before we leave. You know, most of us are showering here. We're leaving our clothes. I just went through my post-shift ritual of literally taking a Clorox type wipe and wiping down every single thing I carry, my little flashlight, my pens, my name badge, my stethoscope, every single thing that I carry, I wipe down and then put in my bag. My next step is I'll get out of all these clothes, I'll shower here, I'll put these clothes in a plastic bag, and then I'll put on a different set of clothes and I'll drive home. It's really kind of interesting. Things have changed a lot in the last month. My specialty has changed a lot in the last month. The stuff that we're seeing, the things that we're seeing are almost unbelievable. When we look, if I explained this to somebody 2-3 months ago, to one of my colleagues, no one would have believed me. But what we're dealing with now, I don't know if you can tell, but I actually have a blister on my nose from the stupid N95 mask we have to wear for the entire shift. These things are designed to be put on for brief periods of time and then taken off. They're incredibly uncomfortable. Now we're wearing an N95 mask plus a regular mask. I nearly had to intubate somebody this morning, and we have what's called a striker peeper mask, and I'll post a picture of me in it. I look like a spaceman. It's got a breathing apparatus, and it's crazy. What we're doing now changes day to day. What are we seeing in the emergency department? Well, we're seeing a lot of sick people. We are having, unfortunately, a huge outbreak in nursing homes locally. I think well over 100 patients in this county and in the adjacent county where I live. It's a travesty. Most of these places did not have PPE. Some of them have actually, a few weeks ago, were refusing to let their employees come in wearing gowns or goggles, or weren't providing them. And now we're having this massive outbreak. This is preventable. We could have foreseen this, but it's incredible when you look at the numbers nationwide. There have been something like 3,500 nursing home deaths, but 450 just in the last week to 10 days. That number is probably far higher, because if a patient wasn't diagnosed with COVID but they die, we don't count it. We're not testing people post-mortem. And these are high-risk people, so when COVID gets into a nursing home, it is going to be devastating. Somebody posted this morning on my feed, asking, how could this happen if the nursing homes are locked down? The problem is that we still have to have staff. They still need people to go in there and take care of these folks. And, the folks that work in the nursing home are not provided with the level of personal protective devices and equipment that we have in the hospital. And all it takes is just one person to go into work sick. And remember, we've talked about asymptomatic spreaders and the fact that there's a 3 to 5 day period of time where you can be infected and have no symptoms whatsoever. So all it takes is somebody, unbeknownst to them, who's infected, to go and give it to one person in the nursing home. And unfortunately, it's like a cruise ship, because it's a confined space. They're all together, and once one person gets it, nearly certainly the majority of the people in that nursing home are going to get it. And these are the people who are at the highest risk, the people who are chronically ill, that are really at risk for developing the fatal complications of this virus. And it's heartbreaking when they came in. We had a gentleman last night that came in, and he was dying, and he was positive for COVID. He's from one of the nursing homes that had the outbreak, and his daughter has a chronic medical problem and can't come in to see him. And she said goodbye to her father via FaceTime from one of our phones last night. And that's absolutely a horrible way to have to say goodbye to one of your loved ones, but also, if you're that person that's, spending its last few hours on this earth is, alone, I mean, our staff is trying to be supportive and everything else, but you can't, your family members can't be here with you, especially if they are folks that are at risk. And it's absolutely heartbreaking. I've never thought we'd have to deal with that. And on the other end of things, I had a gentleman that came in this morning who at home had an oxygen saturation of 50%, which we would have all sworn 3 months ago was not compatible with life. And EMS came, they gave him a couple breathing treatments en route, they put him on oxygen. And when he got to me, his oxygen levels were up to 80%, and he actually looked pretty good. And guess what? We didn't intubate him. We put him on high flow oxygen. He's perked up. And just a few weeks ago, we would have intubated this patient almost instantly. As a matter of fact, I got fully gowned up in the whole Stryker outfit. We were all ready to intubate him. And he came in and was kind of looking around a little terrified because there's a bunch of aliens wearing masks and spacesuits around him. But, he's doing pretty well, and we'll see. He may need respiratory support at some point. But for right now, he's doing well. This is not a virus to be messing around with. I think that we're all sort of surprised at the lower numbers of cases that we're seeing. A lot of that probably has to do with the social distancing. I don't know what the answer is. Antibody testing is probably going to give us a much better read on how many people are actually infected. There are some studies that showed from China that showed about 50% of the people that they did antibody or did testing on were asymptomatic, meaning when they tested positive for the virus, they did not have any symptoms. And about 18% of those people never went on to develop symptoms. So, in that particular study, which was not peer-reviewed and relatively small, but, those were interesting numbers. That 18% of those people who were positive didn't have symptoms. We've seen some similar numbers in other studies as well. And, if that's true, if 18 or 20% of patients don't have symptoms, but they can still spread the virus, then we may have far more infections than we currently think. The Johns Hopkins tracker I noticed this morning just started tracking the number of tests that have done, and I'll pull it up here. It looks like in the U.S. we've done nearly 3 million tests. And you can go and you can see that in New York they've done almost 500,000. California's done 200,000. Florida's done 200,000. Texas 130,000. So the testing is ramping up, and that testing is probably going to finally give us good information, because you know what? We can't reopen until we know what the heck is going on. And right now I'm not really convinced that we do. And the only way we're going to know is to start doing more and more testing of positive, do contact tracing, find out who's positive, and also start tracking who has had it and is negative, is now immune because they have antibodies, because that's going to be the way forward to reopen the country. And this week we're going to really spend some time talking about what that entails. I'm a bit beat this morning. I'm not going to get into it, but I'm going to talk about it tomorrow. Tomorrow I'm actually going to have a guest on one of my good friends and colleagues, John Bream, who's an emergency medicine doctor, is going to join me, and we're going to talk about a little bit of our thoughts, what our experience has been working in the emergency department, what our thoughts are about what we need to do to get back to, some semblance of normality, how long we think that might happen, and also I think we're going to probably talk about this nursing home crisis. We may talk about some therapies, and then as we go along through the week, we'll again, the theme is going to be, how do we get back to normal? What conditions need to be set in order for us to do that? What that might look like in a couple different scenarios. So I'm going to sign off here now. I'm tired. I'm going to go to bed. Please leave any questions you might have below. I will try to get to them with tomorrow. Stay safe. Wash your hands. Protect yourselves. Protect your families. Look after everybody else around you, and I will talk to you tomorrow. Good night.